Part of a very active week of weather to wrap up 2021.
How about this? It's going to start with rain, then some snow, followed by some of the coldest temperatures to hit our area in years. Some cities could have low temperatures in the single digits.
KOMO has team coverage tonight, including meteorologist Kristen Clark with the most up-to-date forecast.
But we want to start with KOMO's Tammy Mutasa. She's live in Seattle for us tonight with how the city is preparing, Tammy, for this deep freeze.
Yeah, Michelle, you know, this is really serious. Officials say they haven't seen temperatures this low in a really long time. And a lot of city departments are stretched thin. So the mayor says, please don't make it harder for crews to keep you safe. Stay off the roads, especially in tricky situations like this notorious hill on Queen Anne, where we've seen a lot of problems in past weather events. A history-making, brutal winter blast is heading our way. Seattle is bracing for it with the same urgency as the historic snow stunner that dumped a staggering 9 inches just in February. This time, snow will be followed by dangerously cold temperatures we haven't seen in more than a decade.
We're looking forward to surviving whatever comes.
At Five Corners hardware store, ice melt and faucet covers have been added to the Christmas shopping list.
We've learned that the best way to adapt to the snow around here is just be ready for it. So we've got all the right gear.
The weather threat is coming in the time of the Omicron threat.
Please, if you can stay home, stay home. Not just because of Omicron, but because of the weather we're going to have.
City departments are preparing as best as they can, but the mayor says they've been hit too.
This pandemic really has stretched every one of our departments thin.
On the roads, SDOT will start 24/7 patrolling city streets as early as Friday.
We've just learned from experience that it's always a good idea to be prepared 24 hours before a storm might hit, because the storm could come early.
They've had to pull plow truck drivers from vacation to make up for staffing shortages.
We are getting hit, unfortunately, by the continued pandemic and Omicron.
To keep people warm, 2 severe shelters are opening up on Saturday at Seattle Center's Exhibition Hall and Compass Housing Alliance in Pioneer Square, both holding up to 200 people. Ahead of the Arctic blast, the mindset is to hope for the best and prepare for anything.
Every time you leave your house, you may be putting not just yourself at jeopardy, but making it harder for those city workers to have to keep you safe.
About a Grinch, new tonight, the producers of an extravagant, walkable holiday light show in Maple Valley spent hours today replacing expensive power cords that were stolen by copper wire thieves right before Christmas. But the show, it must go on. This is a live look tonight at the display. It is back in full swing. We're happy to report for its final night. KOMO Steve McCarron joins us now live from the live desk with a closer look. And boy, copper theft, such a big problem, and we're talking thousands of dollars.
Thousands of dollars. We're talking about bad timing and also a lot of money here, Michelle. The sheriff's office says at least $10,000 worth. The producers of that show tell me it was likely double that, maybe even more. And because of what these thieves did, last night's show had to be canceled. Organizers have been working all day to make sure the show's final night tonight goes on.
Whoever it was,
if you look, they clipped it right here about halfway through.
likely came to the grounds of New Community Church with a mission. Large power cords used to light up an extravagant holiday show clipped right off sometime late Tuesday night or early Wednesday morning.
This is the main power source right here. The generator was locked up over with the trailer.
That was hit too. So were the heads of several reindeer figures.
This had to have taken a good chunk of time.
That's what I was saying, and they're not light cords. Like, I'm a big guy, and I'm tired after carrying one 100 feet.
The King County Sheriff's Office says what happened here was part of a recent uptick in metal theft. Copper wire inside, likely then sold for cash.
There's a good amount of copper inside.
This was the third time Winston Fryer and his team at Dazzle Northwest have been hit here since early December. A recent theft, easily the most severe.
It almost looks like it was a team of people, honestly. Like, they were definitely on a mission and knew what they were doing and came here with a plan.
Tonight, they're relying on rentals to help power the final night of the show, which helps raise money and collect food for the Maple Valley Food Bank. Frustrating, to say the least.
This is like everything I've been doing for the past 2 months.
Just 2 days before Christmas, his focus was just making sure the show goes on.
So I have enough power cords to get us kind of set up. I'll be able to run one from here to here and at least get power over to this corner.
Absolutely, and many of the hospitals are telling us right now that they are at or above capacity, and now with an Omicron surge on the horizon, they are getting worried.
Omicron is serious and it is rapidly spreading. And honestly, our heads are spinning a little bit about how fast it is spreading.
The Washington State Hospital Association says capacity is already more constrained than at any point during the COVID-19 response, with many hospitals at or above 120% capacity.
Right now, surgeries and scheduled procedures are being canceled and patients are being cared for in hallways and waiting rooms. That's the reality of being at the level of capacity that hospitals are right now.
The people who run Providence Everett say it's full of people who don't really need to be there.
The result is that now we're in a crisis with hospital capacity. My hospital of 600 beds, over 100 of them are patients that no longer need to be in the hospital, that are waiting for a skilled nursing facility or an adult family home placement and simply can't be placed.
The Hospital Association says it's a bureaucratic hangup, with nursing homes not being able to handle or afford the influx from hospitals, and hospitals saying they don't have enough authority to help people leave. They're asking the governor and legislature to clarify state law to allow close family and friends to consent to long-term care for their loved ones, to fund additional DSHS staff for acute care hospital transitions, and fund public guardianships for low-income patients, among other things, to help people leave the hospitals, some of them stuck for a month, even up to a year.
And that's why it's so important to deal with this now, to address this, because we really don't have a lot of cushion and capacity left over to absorb a large wave of patients.
The UW's Institute of Health Metrics and Evaluation is out with a staggering projection about the Omicron variant. Researchers now predict that there will be nearly 3 billion cases worldwide in the next 2 months. That would equal the number of global cases since the pandemic started. And scientists say that just like other variants, the unvaccinated are the most at risk.
For individuals who are, fully vaccinated and with third dose, there's very low risk for them. And then for individuals who are unvaccinated and never infected, the risk is going to be much, much higher.
In a bit of positive news, the Institute projects fewer deaths and hospitalizations from Omicron compared to the Delta variant. This chart from the Institute of Health Metrics and Evaluation shows the projected hospitalizations for our state. The purple line shows a big increase in the need for hospital beds starting in mid-January, but still not as bad as what we experienced in late September. The green line charts the need for ICU beds, and you can see that it only shows a slight increase in the coming weeks.
A huge spike in COVID-19 infections and the rapid spread of the Omicron variant will likely hit Washington hospitals and staff hard. Many of those frontline workers say they're already seriously stressed and exhausted from treating the Delta variant. KOMO Suzanne Fawn joins us now. She went one-on-one with several nurses about what's to come and really managing it all. Suzanne.
I've talked to so many nurses over the past few days, weeks, and months. One trauma nurse tells me that she had to take time off for her mental health because she was just exhausted from the pandemic. Other nurses I've talked to have transferred out of the ICU. Now, with the Omicron surge ahead, many of them say they're just bracing themselves and they have no choice but to take it one day at a time. Staggering new IHME projections mean our frontline healthcare workers are being pushed further than ever before, says Lynette Veers, president of the Washington State Nursing Association.
Oftentimes, you just see our nurses are sort of emotionally bankrupt. It is just paralyzing when you're repeatedly seeing your patient after patient dying.
IHME projects that 3 billion new COVID-19 infections will span the globe by February.
To take on that huge number is just almost debilitating.
Everyone is tired.
Katie Roth is a float nurse at Providence Everett Regional Medical Center. She works 3 shifts a week, each shift 16 hours.
I've never worked more hours than I have the last 2 years.
She and other healthcare staff tackle an influx of patients, and a substantial number of them are COVID patients.
We have 40 or 50 now, and we are still at 120% capacity.
IHME projections indicate that by March 1st, Washington State will see a total of more than 10,000 COVID-related deaths.
Those deaths do not have to happen. If they were able to use their mask, social distance, get their vaccines.
The number of hospitalizations and deaths are not expected to rise for Omicron cases like Delta. But still, there's another concern about the highly infectious variant.
My concern with Omicron is before the pandemic, our hospital was above capacity and short-staffed.
With Omicron variant cases expected to skyrocket, healthcare staff are in greater danger too.
We could lose healthcare staff that would be sick, and then they wouldn't be there also to take care of patients.
Hey everybody, I'm Eric Johnson from KOMO News. Thanks for checking out the KOMO YouTube channel. You can see more of our videos right here by clicking on the video links for more news from the Seattle area and all of Western Washington. And don't forget to click the subscribe button below